Innovative
solutions. Can you imagine how much genius and focus it took to turn a music player into a handheld computer phone GPS remote control for everything in life in just 5 years? Seriously.
Innovative
Solutions.
The more you know, the less you fear.
Revolutionize business models and make old ones obsolete or not. One thing is for certain, today we compete on service, price or innovation, and the expectations and metrics around each are tighter than ever.
What's working, what's not, who's competent, who's not.
And that's all about how do you deal with failure.
Opened more stuff. That's what economists call growth.
Innovative
Solutions.
Prepared and presented by Francisco Porras Jr. Weekdays here on the Nation Station.
Innovative
Solutions.
Artificial intelligence is rapidly becoming an important approach across biomedical discovery, clinical research, diagnostics, devices, precision medicine. Now with the development of the pandemic, medical providers, institutions, commercial developers are considering how to apply these new technology to confront the threat of this current crisis. To talk about this new innovation is one of the main professors, master's degree in computer science and information technology and PhD degree in computer science. He won the first National Research Award here in the country. It's an honor and privilege to have with us Dr. Sherimon Cherian. And, of course, Dr. Vinu Sherimon from the University of Technology and Applied Sciences. Guys, welcome to the program.
Thank you.
Doc, why this research? What prompted you to do this? Why do you think it's important to have this in the country?
In April, the Ministry of Higher Education, Research and Innovation, the former Research Council, TRC, invited the calls for the proposal for projects addressing the current COVID-19 pandemic. That means how we can support the country, the researchers. Then together, myself, with the medical doctors of ROP Hospital and a team from University of Technology and Applied Sciences, that means we three institutes, Royal Oman Police Hospital, Arbopan University, and University of Technology and Applied Sciences, we discuss about how we can have a solution to support the country, the nation, during this pandemic. The first idea to develop a telemedicine system. But there were many telemedicine systems. Then we come up with a conclusion to have a project or a research work, a system to support the medical practitioner in a sultanate by developing a complete artificial intelligence-based clinical decision support system. Then initially, the Royal Oman Police operates several satellite clinics in the interior regions of Oman. During the pandemic, even the city hospital, even the expert doctor also was in a situation what to do. This was the real scenario during the pandemic started. Then we thought that how we can support the interior regions of Oman, especially there may not be the expert doctor may not be there. So we thought of developing this system, especially to support the interior, the satellite clinics of Royal Oman Police. Our system is different from the existing system as we are incorporating artificial intelligence completely in each part of this project. So I would like to mention the team members also at this moment. It is Dr. Abdul Malik Al-Karousi from Royal Oman Police Hospital, and Dr. Sherimon Bizi from Arab Open University, Dr. N.G. Matthew from Royal Oman Police Hospital, Dr. Vinu Sherimon and Dr. Huda Salim Al-Suhaili from University of Technology and Applied Sciences. Then again, Dr. Rahul V. Nair and Dr. Khalid Sheikh, Dr. Hilal Khalid Al-Ghafri, and Dr. Sandeep M. Kumar from Royal Oman Police from the medical team supported in this project.
So what is the role of ontology in this project, Doc?
Regarding this project, there were three objectives in this research. I will just brief what is the exact content of the project. The first objective is to develop an artificial intelligence-based online symptom checker. So what we thought, the people can check their COVID symptom directly from the home, our online system.
Okay.
Our expert system, the people can enter their details directly in the system, and even they can narrate because the sound is enabled, even they don't have to type anything. So the system will give the recommendation. As per the recommendation as per the critical situation of the patient, either the system will give recommendation to be at home or because the guidelines were there, or the system will recommend to go to the clinic. Even the clinic itself, the process is starting from that one. The second important research component of this project, we made a X-ray analyzer using deep learning.
Yes.
Deep learning is one of the components in artificial intelligence. It was one of the wonderful modules in this research. Because the system will automatically analyze the X-ray and the system will give the recommendation.
Wow.
One of the major problems during this pandemic was pneumonia. Because any patient, do they have pneumonia means it is always the situation was different. So we treated this module in a way that even though the medical expert for the junior doctors also, they nothing to do. The system will automatically analyze the X-ray and it will give the recommendations of the importance of the patient situations directly to the medical practitioner. We have used Google Teachable Machine, the technology we use to train the model using the deep learning. And the third one is, the treatment from the regional center, the satellite clinic, we made an exclusive video conferencing system using technology with high security to treat the patient. That means the referral, the city hospital or the main hospital, the expert doctor can directly treat the patient in the regional center. That means the junior doctors can get the help directly by seeing the patient. This was another beauty of the research. So we made as a complete system to support the nation.
So is this existing already or is it underway?
It is implemented. It is implemented and we have completed the project and it is ready to implement. We have given the presentation and everything in the ministry. Now the next step is from the other officials to go ahead.
Still pending, but it's already there, right?
Exactly.
How does the CDSS as an expert system work here? How did the X-ray, the chest diagnosis work here?
Hi, can I answer the question?
Yes.
So basically our clinical decision support system, we have different modules in the system. So if you are at home and if you have a suspect of COVID-19 infection, then we can use our symptom checker. It is an web application.
Okay.
And we have two different interfaces. One is we can type the answer. So this is based on a questionnaire.
Okay. It's going to be the questionnaire, yes.
So there will be different questions regarding the current symptoms, history of the patients, and if you have any comorbidities and other clinical issues, everything will be asked.
Okay.
So this interface, one is normal web interface and other is it's like a kind of humanoid. We made like a humanoid and it is in Arabic and English. Right. This humanoid kind of thing, it will be asking questions. So you can answer to this. So we have trained that model to listen to the questions and to give produce the report, the full report, and the system will give recommendation. So if the probability of the infection is high, for example, if you have chest discomfort or high temperature, then the humanoid will give the conclusion to guide to go to the nearest COVID care center immediately. So that is the first module. Then once the patient arrives to the hospital, then our CDSs, we have separate user interfaces for the nurse, doctors, even lab technicians, radiologists, everyone will use our CDSs. So again, the questionnaire, the triage staff or the nurse, they will enter other values, our temperature, BP, all the other things will be added. So the system again will analyze the current situation of the patient and suitable alerts or recommendations will be given. So for example, we have categorized the patients into four, like mild, moderate, severe, and critical.
Okay.
So if the patient, the values are not that much problematic, like if it is a mild case, then the guidelines, actually we have incorporated the guidelines to give suitable medicines, to show the recommendations of medicines.
Okay.
So even without forwarding the patient physically to the doctor, the system can show the recommendations, and with the approval of the doctor, the nurse or the triad staff can give the medicines. Or if the patient is in a critical condition, then then the patient will be physically forwarded to the doctors. And again, our CDSs will give suitable recommendations regarding the blood test to be conducted, if it is a severe infection is there, or X-rays, everything will be given. So every stage, the system will give alerts and recommendations to the user, whether it is a normal user or the clinical practitioner.
This is based, doctor, from the patient's history, right?
Yes.
So, for example, if the patient had an X-ray, or you could just scan it and go directly to the computer, right? And,
yes.
Okay.
Yeah, in that case, our the AI radiologist, artificial intelligence radiologist, we have implemented a module, and we have used the TensorFlow flow framework to train a deep learning model. Actually, we used several, open data sets, which is having a large collection of X-rays. We have used from the open data set we have taken from National Institute of Healthcare, because, it's very difficult to get at the beginning. If you want to train a model, we need a large number of X-rays. So we have used from NIH and the US Department of Health. So these thousands of X-rays, these X-rays were of COVID-19 cases, even normal patients and other respiratory pathologies also we have considered. So in addition to the COVID-19 cases, if the patient is suffering from other type of problems, that will also be noted by our artificial intelligence radiologist. So this will be really helpful for our junior doctors. Plus, they can also analyze manually. So this is like an additional support we have given.
We're going to be back for a bit and continue our discussion in just a while.
Innovative
Solutions. Can you imagine how much genius and focus it took to turn a music player into a handheld computer phone, GPS, remote control for everything in life in just 5 years? Seriously.
Innovative
Solutions.
The more you know, the less you fear.
Revolutionize business models and make old ones obsolete or not. One thing is for certain, today we compete on service, price or innovation, and the expectations and metrics around each are tighter than ever.
What's working, what's not, who's competent, who's not.
And that's all about how do you deal with failure.
Opened more stuff. That's what economists call growth.
Innovative
Solutions.
Prepared and presented by Francisco Porras Jr. Weekdays here on the Nation Station.
Innovative
Solutions.
Welcome back to Innovative Solutions. So which health facilities are covered by this project?
Symptom checker, if the general public can use this symptom checker, as I mentioned before, it's a normal web app, or if you want to go for the voice-enabled interface, you can go use that. So that will help you to find out your current situation, because if we have that tension, if we are infected or not, just use this web application, mainly the voice-enabled interface, because maybe everyone will not be able to read the question and understand and give the answer to the questionnaire. So we have used the voice-enabled one. So it is in Arabic and in English. So they will be able to give their current symptoms, and then they can get the recommendations. Like if there is no other symptom, if the travel history is clear, then the system will give recommendations for caring, only just like quarantine, stay at home, like that. But if the probability of infection is very high, then the system will be giving the recommendation to go to the nearest COVID care center. Then the other facility is our X-ray analysis system. This is we have used deep learning techniques to the algorithms we have implemented for analyzing the X-ray. So this is really helpful for the doctor to come to a conclusion regarding the chest X-ray. Then coming to the last main facilities, the teleconferencing services. Like we did not use any third-party software like Zoom or anything for doing the consultation because mainly our CDSs we were focusing on the satellite clinics of Royal Oman Police.
Okay.
So if the doctors if they have any doubt in the X-rays or if they have any doubts in the lab reports, they can use our teleconferencing app. This we have used Web RTC. This is an open framework, web real-time communication. So this is a web app. It will be we can use that to stream audio or video media because since the ROP they take care of security. We are mainly going to exchange patient documents. So that's why we did not depend on integrating any other third-party software. So that module also we have incorporated in our CDSs, the Web RTC-based system.
How is it different from machine learning here?
The symptom checker, voice-enabled symptom checker, this actually, we have to train the machine to listen to the question, understand and respond. So, and particularly in Arabic and English, because, when we talk, when we say yes or no, the voice should be recognized. So that is the main challenge there. So we have incorporated different voices. Even in Arabic also, we took the help from our Arabic colleagues, particularly Royal Oman Police Hospital. They have taken the help of the Arabic speakers to pronounce the yes or like la. I am not sure about how they have given different way of pronouncing. Then the system, so this is how we have trained the model. Then only it will be able to listen to the answers and take a conclusion.
So thank you very much, Dr. Vinu Sherimon, for that clarification. I think everything is clear right now. Dr. Sherimon, what are the possible challenges and limitations of this system? Do you have any idea?
Actually, when we are looking for the challenges in implementation, we did not include the module to follow up the patient.
Okay.
Because during the pandemic, we were not able to implement that one. So because it is a customized as per the guidelines of the Ministry of Health, Oman, and of course, they were not capable of mimicking the decision making at the level of the human mind.
Oh, yeah.
So CDSs cannot independently keep because it is constantly evolving the healthcare knowledge. That the guidelines are changing rapidly.
Yes.
Because during the starting of the pandemic, the way we treat, maybe it is entirely different way we treat now.
Yes.
Okay, because it was completely new to the medical world also.
Yeah.
So these are the few challenges we face. But as from computer science point of view, maybe we did not feel much challenges. Of course, in implementing any such system, there will be some challenges. That is the reality.
So this will be implemented probably within the year.
Exactly.
Yeah. Okay.
And we have published this research in the international conference, and also we have published it in the International Springer Journal also. So the worldwide the research is now accepted.
Congratulations for this one. This is a huge team effort from
Exactly. When you are publishing the research only, we will get the real benefit of that one. That is the research community.
Responding to the needs of the healthcare, what can individuals who are working in the AI do to help healthcare practitioners? What tools can others, such as manufacturing community, use to help healthcare workers right now?
Tomorrow's medical world will be artificial intelligence based. There is no doubt in that.
Okay.
Maybe we cannot exaggerate the things, but even we can say that there will be a day, maybe the medical practitioner has to be fully dependent on AI techniques. Because even the X-ray analyzer or even for any kind of, because how the treatment is happening because of the guidelines. For any treatment, there is a guideline. Other than the surgery, I feel that 90% of the automation is possible in medical sciences. So tomorrow's world is artificial intelligence. It's subdivision, of course, ontology, machine learning, deep learning. All these are there actually. But basically we can say that tomorrow's world is AI-based. So we have to educate our children in that way, and all our medical professionals should be capable of handling this technology. And I feel that our team, I feel very happy that our team of medical doctors, some of them are expert with us in the technology. That was the reason we could achieve this implementation within limited time. That is the beauty.
So how can the system be maximized for future use? What are your recommendations regarding this one?
Our AI-enabled symptom checker, you can implement in any public place. Because we can avoid any contact, because our humanoid is there. It can directly check. It can be used in any public places. But we need the government decisions and support on all these things.
Yeah.
And also, there are many primary health centers are there in Oman. Other than the Salday Clinic, the Ministry of Health, their primary health centers are there in Oman. And, it can be implemented. And we are trying to have a connection with the Ministry of Health in this aspect. We are trying to have some meetings to implement this system in the primary health centers. So definitely the same model, it will be useful. And even we had a presentation in a Royal Hospital, the leading hospital in Oman, about the implementation of this system.
Okay.
And the radiologist, AI radiologist, we are ready to support any hospital in Sultanate, either in private sector or public sector. They can use it to maximize the use of the AI and even computer science and modern techniques in our medical scenario.
Okay.
The last one is the teleconference application. It is completely secure. It is completely secure. Only for the medical use we made it. So I think we have to utilize the research. Then only there is a meaning in research. Then only we have to make it as a product and we have to use it. Then only the result of the real research will come into the effect.
Okay. How about vaccination? Do you have any plans of using this for vaccination?
No, not yet. We have almost completed this project before vaccination started. So we did not think anything about vaccination during this research.
Okay, but you have plans of is it going to be okay if it's going to be applied for the plan of vaccination research later on, maybe for COVID-19?
Yeah, definitely we can in the future, as a future, because any AI systems, you can expand it. Okay. And even in the medical profession, medical domains are always changing. So there is a scope of expansion. Definitely we can append all these kinds of technology to this one. No problem in that.
Okay. So what's next for you now? Do you have any ongoing research or projects coming up?
Yeah, alhamdulillah, we have several research projects are going with the Ministry of Higher Education, Research and Innovation. And, we are very happy with the government of Oman. The government is motivating the research like anything. I am very happy. This is my 19th year I am in Oman. Okay. I was before in Takniya, Kulliya, that means a higher college of technology. In 2010, I joined in Arab Open University. And I feel that the government of Oman, especially the former Research Council, is supporting research like anything in the country. So my advice and my request to all young researchers, anyone, those who are studying, they have to come to research, because tomorrow's world is research. Tomorrow's education is research. Without research, without innovation, without technology, any stream of the life, we cannot survive. This is the reality. So we have to maximize the research culture in the Sultanate. And this is my suggestion and this is my advice to the community.
Okay. So globally, people and groups are grappling for an immediate recommendation. One way experts are helping researchers to improve confidence in their hypothesis for research development. Specifically for frontline medical practitioners, the degree of confidence is pretty high. They should have in the recommendation produced by a learning system, especially in this kind of project, will definitely lead to positive situations. Doc, thank you very much for being here. It gives a clear picture of what octology is all about in times of COVID.
Thank you. Thank you very much for the opportunity. Thanks a lot.
Okay.
Thank you. I would like to thank our entire team. Myself and Dr. Huda Al-Sheili, we are from Department of IT, University of Technology and Applied Sciences. We were very happy to join the project. And our medical team, they were very effective. As Dr. Sherimon informed that many of them, they were really interested to join the project. And because without them it is not possible to implement, because the guidelines, even the development of deep learning, they were really involved. So I would like to thank Arab Open University, because the project is granted to Arab Open University for their full support for the successful completion of this project, and ultimately the Ministry of Higher Education, Research and Innovation for granting us the project, and the Royal Oman Police Hospital. So I would like to thank the entire team for this the successful implementation of this project. Now we are waiting for the final approval from the Ministry of Health, so to implement this as a product in different primary health centers of Oman.
Okay. Dr. Cherian, any final words before we wrap things up?
No, thank you. I would like to thank Arab Open University support to the community. That is my final word.
All the best and more success to your upcoming plans in the future.
Thank you very much.
That's the first national research awardees who have been very active in the research for COVID-19 solutions from the Arab Open University, Dr. Sherimon Cherian, and of course, Dr. Vinu Sherimon from the University of Technology and Applied Sciences. I'm Frank for Innovative Solutions. Thanks for listening.
Innovative
Solutions. Can you imagine how much genius and focus it took to turn a music player into a handheld computer phone, GPS, remote control for everything in life in just 5 years? Seriously.
Innovative
Solutions.
The more you know, the less you fear.
Revolutionize business models and make old ones obsolete or not. One thing is for certain, today we compete on service, price or innovation, and the expectations and metrics around each are tighter than ever.
What's working, what's not, who's competent, who's not.
And that's all about how do you deal with failure.
Opened more stuff. That's what economists call growth.
Innovative
Solutions.
Prepared and presented by Francisco Porras Jr. Weekdays here on the Nation Station.
Innovative
Solutions.